Survivor, one who remains alive and continues to function during and after overcoming a serious hardship or life-threatening disease. In oncology terms, a person diagnosed with cancer becomes a survivor at the time of diagnosis.
Hello, I'm Sarah Erger, nurse practitioner for medical oncology at the Cancer Center at Cookeville Regional.
And I'm Amy Ayers, the breast health nurse navigator, and we're here today to talk to you about survivorship.
You have just endured the difficult journey of active treatment for your breast cancer diagnosis. The whirlwind of finding out that you have cancer, seemingly unending appointments, surgery, radiation treatments, and for some, chemotherapy and immunotherapy. You are now a member of a fellowship that you never expected, and you have endured.
Here at Cookeville Regional, we want to partner with you as you continue on this path through cancer survivorship. We hope this video will be a helpful resource for you as you enter this next phase of your journey. First of all, we want to reassure you that however you're feeling is 100% okay. Relief, fear, sadness, joy, anger, happiness, even guilt. These are all normal feelings for someone in your shoes. We encourage you to confide in someone, your spouse, significant other, a friend, a fellow survivor, medical health professional. It takes time to work through and process your experience. There are so many feelings at this point in the journey, and they can be overwhelming.
While our local support groups are currently not meeting in person, we are hopeful that we will be able to resume those services in the near future. In the meantime, the American Cancer Society offers the Reach to Recovery program for breast cancer survivors, wherever they may be in their breast cancer journey. You can find more information online at reach.cancer.org.
There are many local professionals who provide counseling services. We encourage you to find someone you feel comfortable speaking with about your experience. Our social workers have a list of providers should you feel you need this type of service.
One unique cancer support service is Ymca Angels, which is available to patients nationwide. Ymca Angels' mission is to provide comfort and understanding for all cancer fighters, survivors, and caregivers through a personalized one-on-one connection with someone who has been there. And they also assist interested survivors in becoming mentor angels themselves. You can find more about this unique program at ymcaangels.org or ask one of our social workers for a brochure.
The surveillance plan is one of the most important aspects of cancer survivorship. Uncertainty and fear of reoccurrence is something nearly all cancer survivors struggle with. This is why we follow the National Comprehensive Cancer Network, or NCCN, guidelines for surveillance following completion of active therapies.
The surveillance plan outlines how we will follow up with you now that you have finished with active therapies.
The NCCN guidelines for surveillance following treatment for invasive breast cancer include office visit, including clinical breast exam with medical oncologist every 3 to 6 months for 5 years, then annually with your PCP. Monthly self-breast exams, report any new breast changes promptly. Screening with annual mammography. Remember that routine imaging of reconstructed breast is generally not indicated. DEXA scan every 2 years for patients taking aromatase inhibitors such as Arimidex, Aromacin, and Femara. Annual GYN assessment for patients on tamoxifen. Echocardiogram for patients treated with adriamycin, Perjeta, and Herceptin. Genetic counseling if recommended by your physician. We are blessed to have a genetic counselor in our practice, the only such professional in the Upper Cumberland area. It is important to continue routine health maintenance, age-appropriate cancer screenings, and immunizations with your PCP.
If you would like a printed copy of your surveillance plan, please ask for one at your next visit or call and one can be mailed to you. And please remember, these are recommended guidelines, and due to different patient circumstances and physician preferences, your plan may differ in some ways from the recommendations we have discussed. We have many resources at the Cancer Center and Cookeville Regional to help you in many areas, such as registered dietitians, licensed social workers, smoking cessation classes, lymphedema, and neuropathy management. And if there is something that you need assistance with, please just ask and we will do our best to help.
Fatigue is a frequent complaint both during and after cancer treatment. It can be linked to anxiety, depression, and overall decreased quality of life.
One of the most important things you can do during and after cancer treatment is to exercise. Research supports that physical activity significantly decreases disease and treatment-related fatigue.
In addition, exercise may improve quality of life by helping to manage anxiety and depression, improving sleep quality, managing lymphedema, maintaining bone and muscle strength, and decreasing disease recurrence.
And you don't have to start CrossFit or running marathons either. Simply taking a 30-minute walk every day can be of benefit. It can take months following treatment to feel like yourself again, and exercise can help get you back on track.
One amazing resource that we have here is our Gopink program through the YMCA.
My name is Jenny Thacker, and I'm the Outreach Director at the Putnam County Family YMCA. And I would love to tell you more about our Gopink program offered here. The Putnam County Family YMCA offers the Gopink program to any breast cancer survivor, no matter when you were diagnosed. The program provides a free 6 months YMCA membership that includes personal training, nutrition counseling, support groups, exercise groups, and educational seminars. Outside of the Putnam County, most YMCAs offer similar services. Just call your local YMCA for more information. The first time a survivor comes to the YMCA, we will sit down and talk about their diagnosis and treatment procedures that they have undergone. We will go and walk around and take a tour of our facility and talk about the program highlights and who they will be working with and what their program would look like. We want to make sure all of our breast cancer survivors that are part of the program that they understand that this is a recovery program, and so it is customized for each survivor. We want you all to come and feel comfortable and invited, and it is for you and your needs. We welcome anyone that has never exercised before or exercise frequently, and we want you to gain that strength and energy to get back out and do the things that you love to enjoy doing. And we would love for everyone to come and be a part of the Gopink program.
We hope that you have found this video informative and gained valuable knowledge and recommendations. We will continue to partner with you in the coming years and remain available whenever we are needed. Please feel free to contact the Cancer Center at 931-783-2497 with questions or for additional information about any of the resources we have presented. We wish you the very best as you continue the survivorship journey. Thank you for watching.
If you found this video helpful, please help us out by following the link to the survey that follows and giving us some feedback.